Hello everyone, I am Dr. Beena Jaising, Senior Consultant Obstetrician and Laparoscopic Gynecologist working in Manipal Hospitals on Sarjapur Road and in Mom and Baby Clinic in HSR. Endometriosis is a condition where the lining of the uterus that is shed on a monthly basis as menstrual periods is also present outside the uterus. It can be present commonly on the ovaries, presenting itself as the ovarian endometriotic cyst, what we commonly refer to as the chocolate cyst or the endometrioma. They can be present on the fallopian tubes, on the intestines, on the urinary bladder, or they can be sprayed as small dots throughout the lining of the lower abdominal cavity. Now, what are the symptoms that can point out to an obstetrician that probably she is dealing with a patient who is suffering from endometriosis? The patient presents commonly with heavy periods, severely painful periods, many of the times infertility, not being able to conceive is the complaint and the symptom that the patient comes with. And rarely but not uncommonly, many women also experience a long-standing chronic lower abdomen discomfort or pain. Once there is a suspicion, yes, probably I might be dealing with a patient who is suffering from endometriosis, how we go about with the diagnosis? The first and the common diagnostic tools are the obstetrician's hands. It just involves a vaginal or a pelvic examination in the OPD consultation suite. So if there is a large ovarian cyst, it can be palpated by the hands. Likewise, sometimes a endometriotic spot that is present on certain ligaments on the uterus can be felt during the vaginal examination, the pelvic examination, as a painful and a thickened spot. The next diagnostic tool is the basic ultrasonogram or the scan. Ovarian cysts of any size can be picked up on the scan, but endometriosis other than the ovaries, outside the ovary, cannot be diagnosed on scan. This is where the MRI comes into play. The MRI can pick up small endometriotic lesions anywhere in the abdominal cavity. But MRI also has its limitations. Very small, tiny lesions cannot be picked up by endometriosis. So the ultimate or the gold standard of diagnosis of endometriotic lesions is diagnostic laparoscopy. But it is a surgical procedure. In diagnostic laparoscopy, the laparoscopic camera is directly inserted inside the abdominal cavity, and we directly have a clear view of look for any endometriotic spots on any one of the abdominal organs. Once the diagnosis of endometriosis is confirmed, the treatment is targeted towards the symptom. For pain, painkillers and anti-inflammatory are the treatment of choice. When the pain does not get relieved by the basic painkillers and the anti-inflammatory drugs, and when the presenting symptom is heavy periods, then hormonal therapy is the treatment of choice. If the patient comes with complaints of not being able to conceive, infertility, then laparoscopic surgical management of endometriosis is the treatment of choice, where we go and remove the ovarian cyst, the ovarian cystectomy, and we burn out all the endometriotic lesion present within the abdominal cavity.